Welcome everyone to our webinar today on alternative service delivery models for LSVT Loud and LSVT Big. And we're just excited to bring this brand new topic to you that we've never presented before. And we welcome you all and thank you for taking time out of your day to join us. My name is Laura Gousset. I'll be the moderator for today's session. I'm the LSVT Big Chief Clinical Officer and I'm a physical therapist. But the stars of our show today are our panelists that are seen here, and you can see them hopefully in your Zoom panel as well. They've all been spotlighted. I'd like you to welcome Lindsay Butkus, an occupational therapist and LSVT Big certified clinician, Dr. Tammy Hefferon, who's a physical therapist and also one of our LSVT Big training and certification faculty, and also Sherry Zelazny, and I'm sorry, Sherry, if I said your last name incorrectly, and she's a speech language pathologist. And these panelists are experts in their fields and in LSVT Big and in LSVT Loud, and they're going to be representing their various practice areas that we'll be featuring today, including mobile practice, cash-based practice, and telepractice. So I'll go over their biographies briefly here so that you know a little bit more about them, but they will also be giving you some personal information on who they are and how they got where they are today in terms of their practice. Starting with Lindsay, she's been an OT since 2010 and LSVT Big certified since 2017. And she has done many things in her life, starting in the Air National Guard, and she's practiced in virtually all practice settings, as you can see: inpatient rehab, acute care, outpatient, day rehab, and now mobile practice in her area. She's been a continuing education instructor, especially on the topics of stroke and amputation, and she's a recent immigrant to Cincinnati, Ohio, where she started her mobile practice. And she has been amazing in not only providing LSVT Big to her patients with Parkinson's and other neurological disorders, but she's been an active part of our LSVT Big certified clinician Facebook group, helping to mentor other therapists who are certified in LSVT Big as well. Next, we welcome Dr. Tammy Hefferon, a physical therapist. As I mentioned, she's one of our LSVT Big training and certification faculty and has been since 2011. She was certified in LSVT Big in 2009 and has really had a heart and passion for treating patients with early Parkinson's disease and young onset Parkinson's disease. She wears many hats and is not only a physical therapist and clinician, but co-owns her cash-based practice, Impact Physical Therapy, with her husband, Dr. Eric Hefferon, and they are in the Phoenix, Arizona area. She's also an assistant professor and orthopedic specialist at Franklin Pierce University in Phoenix, Arizona. So we're looking forward to hearing more from Tammy as well. And then last but certainly not least, we have Sherry Zelazny, a speech language pathologist who is certified in LSVT Loud. And she hails from British Columbia, although currently she's in the United States for just a bit. And she began her career some time ago, and she has really expanded her expertise in voice and laryngeal airway topics. She's been living in British Columbia since 2011, where she established her Surrey Voice Clinic. And her areas of interest include voice evaluation and treatment, paradoxical vocal fold motion, voice therapy for PD, gender affirming voice training, and community education. And you can see here, she holds the College of Speech and Hearing Health Professionals BC Advanced Competency for Flexible Endoscopic Evaluation of Voice and Swallowing. And she has been LSVT certified in LSVT Loud for more than 20 years. So truly an expert in providing LSVT Loud. She's been an honorary board member of the Wisconsin APDA since 2011 and is a member of the board of directors for the Parkinson's Society in BC since 2012. She was a recipient of the PSBC Above and Beyond Volunteer Recognition Award in May 2018 and the University of Wisconsin Hospital and Clinics Community Service Award for her work with the Wisconsin APDA in 2011. So we welcome Sherry Also, you can see she's a past president of Speech and Hearing BC, so very active in her profession. And we look forward to hearing from you, Sherry, on the topic of telepractice. So all of the panelists, in terms of disclosures, were offered honorarium for their time and expert knowledge. And I am an employee of LSVT Global and receive lecture honorarium as well. Some brief logistics before we crack into our discussion today. I'm sure all of you have joined a Zoom webinar before, but if not, just know that right now your microphones are muted, just so there's no background noise from your different environments. But feel free at any time to type in your questions via the chat box. And Tammy and Lindsay and myself will be helping to moderate that and monitor those questions. Our goal is for this to be really interactive. So as the topics are being presented, we would encourage you to put your questions in or comments into the chat box so that we can address them during that time. We'll take turns. Tammy will speak first on cash-based practice, then Lindsay will speak for about 15 minutes on mobile practice, and then Sherry will speak on telehealth and telepractice. So be sure to not leave this webinar without getting your questions answered. If you do think of questions later, you'll always be able to email us at info@lsvtglobal.com, or if you want a private response to your questions, you can always email us as well. You should have received a handout of the brief slides that we have today via email, but if not, you can always email us at webinars@lsvtglobal.com and ask for that handout. After the webinar, the next day or two, you should be receiving an email from us that will have a link to a survey. We'd ask that you please click on the survey and give us feedback about how we did, how you like the topic, and if you have suggestions for future topics that would be helpful to you, whether you're a clinician or a person with Parkinson's or someone else. A little bit of information on continuing education if you're a therapist joining us today. These webinars are not pre-approved or state registered for CEUs for speech, physical, and occupational therapy professionals, but we would be happy to give you an electronic certificate that you can use for self-report if you'd like to. Just email us at webinars@lsvtglobal.com and we can create a certificate and email it to you. If you're not sure about whether your state accepts self-reported CE activity, the best thing to do is to review your Practice Act or email your state board directly to see what the process is and if they accept those CE activities. If you're listening to this webinar later in the on-demand format, also know that you can request a certificate for self-reported CE activity as well. These are the learning objectives of today's webinar. By the end of it, we hope that you'll be able to define cash-based practice, mobile practice, and telepractice, and tell how they differ from traditional practice models for speech, physical, and occupational therapy. We'd like you to be able to summarize how these therapies, LSVT Loud and LSVT Big, can be offered in cash-based practices, mobile practices, and via telepractice. List the key benefits to clients and providers for each of these service delivery models, and then paraphrase some unique considerations and challenges related to each of these service delivery models. So with that, I'm going to stop my screen sharing right now so that you can see our panelists a little bit more clearly, up close and personal. All right, so give a wave and welcome everyone today. Thank you all so much for coming and joining us. And I think the best way to kick this off is to get to know you a little bit more personally beyond what your biography stated. So Tammy, let's start with you. Can you tell us a little bit about your practice as a physical therapist and really how you got involved in opening a cash-based practice?
Sure. Yeah. Thanks for having me today, and all of us. We're excited to be here. And so, I think that becoming into a cash-based practice was an evolving thought for my husband and I. I had worked in an outpatient hospital-based setting. He had worked in a traditional physical therapy clinic. And I had started to see some people when I switched over to academia. I'd started to see some people kind of like Lindsay will talk about on a mobile basis. I would go into their home and do things. And, they would pay me cash, like no problem. So it was kind of like, okay. And then one night he came home and he had seen 36 patients in one day and was just, and it was like the grind of it. And we were both laying in bed, like, what are we doing? Like, we don't want to do this. Like, we want to be able to be free to do what we want to do and do what we do best. We don't want to be confined by insurance. We don't want to be confined by referrals. So we opened our first practice in July of 2015. So we just had our anniversary for our first practice. And then we opened another practice 2 years later in Scottsdale, Arizona. So we have one in Glendale, Arizona, and one in Scottsdale, Arizona. So we have, several clinicians working for us and support staff. And, as any business owner will tell you, it's hard and but in the end, we both agree that we would go back to any other model. So
that's so great. Thank you, Tammy. And I know that our audience is probably just brimming with questions like, how does it work and everything like that. So anxious to dig in and learn a little bit more from you. Lindsay, how about you? Tell us about your journey as an occupational therapist, your passion for neuro, and how you got to where you are today with your mobile practice.
Sure thing. Thank you so much. I've had a very interesting career in my life, but I'm really thankful that I found occupational therapy and that by the time I got into an outpatient clinic in 2016, I learned about LSVT, loud and big. And I said, this is it. This is exactly what I want to be able to provide for my patients. I see how that can help people a whole lot more. And after doing it at the clinic and really having to help build the program at that clinic, and so I had to market to our referring physicians, and doing that and being listed on the LSVT Global clinician search page, I found patients were finding me directly, and I would have to still send them through the hospital registration system, and maybe I'd see them in 2 to 3 months. And I found that so frustrating, not just for myself, but also for them. They really wanted the care that they could get so that they could get on with life. So that just planted a little seed. And that was back in Chicago. And when we moved to the Cincinnati area 2 years ago, I thought, this is the time. I've got a clean break. I won't be competing with a former employer. And that's the rest is history. I was able to just start a mobile practice, and people started finding me again through the clinician search page.
That's really interesting. And your ramp up, I know, was really fast from, launching to starting clients. So same with Tammy. I can't wait to share more information with our audience today on how you made that happen. I know it wasn't easy, but it's been successful for you. So thank you for joining.
No problem.
And Sherry, you're a veteran. You've been a speech therapist for a long time and have been providing LSVT loud for a long time. I'm sure even before the days of telepractice were probably even a thing, or not a big thing like they were now. So can you tell us a little bit about, your journey and when you ventured into the world of telehealth?
Sure. Thank you also for having me here today. Yes, I have been a speech pathologist for a long time, and I've been doing LSVT for a long time. I think, honestly, I can't remember, the very beginning of the first LSVT patient or how I got involved, but I can tell you that I've had people with Parkinson's in my family, and that has been an incredible motivator for me over the years in my involvement in with providing LSVT and my involvement in the Parkinson's community wherever I have been. And yes, absolutely, before telepractice. I mean, my first telepractice patient was scheduled just prior to the lockdown. So I actually was going to embark on telepractice anyways. And then, like all of us, we just kind of got thrown into it. but I was happy to have several LSVT loud patients throughout COVID, all by telepractice. So yeah, the LSVT and the Parkinson's community have kind of been a theme throughout my career for many, many years. It's just an incredibly rewarding population to work with.
Well, I think we all agree about that. And one thing we have in common is our passion for helping people with PD and other neurodisorders. So thanks for joining us today. All right, now that we know a little bit more about you, I would love to know a little bit more about our audience and who's joining us. And so I'm going to launch a poll here. If you don't mind just taking a second and letting us know who's joining us today. Are you a PT or OT, an SLP, person with Parkinson's, someone else? Of course, that could mean a lot of different things. So I'll give you maybe 10 more seconds or so to vote here. All right. And it looks like almost everyone has voted. And it looks like we have mostly therapists in our audience. You can see 58% are SLPs, 29% are PTs or OTs. We have someone with PD, so welcome, thank you, and a couple of others. So thanks so much for sharing that with us. Now, for those of you that are therapists, we'd like to ask you one more question. We'd love to know, are you certified in LSVT or not? Just so we know how much information we need to give on the programs themselves. So again, if you're a therapist, please answer this question. I'll just give you a few more seconds here until almost everyone has had a chance to vote. Okay, and it looks like we're split almost 50-50. Half of you are LSVT certified and half of you are not yet LSVT certified. So thank you for sharing that information with us. I think that helps us greatly as we're explaining about these different practice settings and how they might be useful in improving accessibility to people with PD that would benefit from the LSVT protocols. And for those of you that aren't certified, I'm assuming you know a little bit about LSVT, that these are evidence-based treatment protocols that have been around for quite a long time, have a ton of research on them, and they're intensive. They're individualized treatments where clients are seen for 1-hour sessions 4 times a week for 4 weeks. And so there's a lot of intensity and how we provide that treatment, deliver the treatment, individualize it to every person. But with that sometimes comes some barriers of transportation difficulties or access to a clinician in their area. So really excited to share this information with you on 3 different practice models that can really benefit people with Parkinson's that are seeking to receive these treatments. So Tammy, I think we're going to kick it off with you for a few minutes, and then we'll move on after that to Lindsay and to Sherry. And just so our audience knows as well, Lindsay has to kick out a few minutes early, about 10 minutes early. So if you have mobile practice questions, be sure to answer them while Lindsay is on deck, because she might not be able to hang on for the whole webinar today. We appreciate her for her time that she came. So Tammy, this might seem like, a silly question to you, but I think it's a question that gets asked a lot. Like, what exactly does cash-based practice mean? Does it mean that every practice or every patient pays cash, or do cash-based practices ever take insurance? How does that work?
That's a great question. And there's a lot of variety amongst people that say they do a cash-based practice, which is probably why there's some confusion, right, as to who does what and how do you do it. In our practice, we would be considered out of network for all insurances. So sometimes when you're taking that insurance question, that's how you can explain it to clients or patients, that it's not that we don't take insurance, it's just that we're out of network, and that it's really the responsibility of the patient to ensure that they submit any bills or anything like that to directly to their insurance company. The other thing that you can do in a cash-based practice that helps out, especially now, most people have a high deductible plan. You know, a lot of our patients will have that. So we take HSA accounts, we take flex spending accounts. So all of that helps kind of offset that. Do you take my insurance? No, click, okay, I'm going to go somewhere else. So I think that that's the majority of how we kind of get around that conversation. We always try to, we never really wanted to be behind the game of collecting money, right? Like we're one of the unique professions that was like, that's fine, don't pay me for 7 months, you know? So we didn't really want to be in that realm. So that's, you know, part of the reason why we chose to collect fee for service, really, like certain day of service.
Yeah. Thank you for explaining that, and that there's a different, you know, that some cash-based practices have different models, that they're not all, you know, exactly the same. And one of the chat questions that just came in is, if you see a patient that's 65 plus, do you have to be a Medicare provider? You know, and I know that's a big question that we could spend an entire webinar on, but do you have a short answer, or, you know, a place where you can point therapists to that are wondering about this question?
Yeah, you know, I think that to serve the Medicare population, the best thing that you can do is go straight to Medicare and really make sure that you read and you understand what the laws and regulations are, so that you have firsthand account of that. There are so many, even today, I'm going to tell you our interpretation, what we do with it, but I'm still going to recommend that you don't just take what I hear through the filter of what you're listening to and just go and apply that. Make sure you really do your homework and understand the regulations around it, so that you feel safe to practice in however a manner you want to practice that way. There are several different ways that you can do Medicare. You can be a participating provider, which means that's traditional Medicare. So they come in to see you, you bill Medicare, Medicare pays you. You can be a non-participating provider, which means the patient actually pays you. So you're guaranteed your money, right? But then you have to bill the Medicare on behalf of the patient, and then Medicare pays the patient back. So it still doesn't get you out of the kind of insurance game if you're going to do those kinds of things. So you know, and billing is very unique in Medicare, and so just understanding that. And making sure that you're still kind of meeting your bottom line, I think is important to go that way. But there's a lot of different options you can do. You can also offer wellness type of scenarios for your patients, which wellness is actually, you can charge cash for your patients. So and that's that. Again, I'm going to tell you to go read that so that you have your interpretation of that. But wellness things, there's a lot that we would say after graduating from LSVT Big would be a great wellness thing for them to continue on, like Big for Life and Loud for Life and all of those kinds of things. And even just kind of more what we would consider maybe maintenance, those would all be considered wellness, which could then be covered via your cash-based services.
Excellent. I love that. And I think that's so important, is to go straight to the source. I think as therapists, sometimes we, you know, we want the quick and easy answer, but it's always, you know, best to really read the regulations and understand it as well. Yeah. So what are the main benefits, do you think, for patients in the kind of care or type of care they might receive in a cash-based practice typically?
Yeah, I mean, I think that, you know, in Arizona, we're direct access. So one of the best things is that they can come straight to us as a provider. And, you know, being a cash-based practice, we're not governed by insurance at all. So we don't need referrals. We don't need any of that kind of thing. So, you know, we go straight to the source for a lot of our patients. So we go to support groups, and we do a lot on social media and things like that, and a lot of word of mouth. And So, if someone is newly diagnosed and maybe their neurologist isn't as quick on the uptake to get them into therapy, they can come directly to us and get started on care right away. So I think that's essential. That's like one of the best things. And then another really big positive is that we're not really hindered by just what the script might say. So let's say, my latest patient that I just saw, he actually, he fell. So he hurt his shoulder during our LSVT time. So I could take a couple of sessions and add him on and really just kind of put my orthopedic hat on and take care of his shoulder and, charge him for multiple visits, still get through our LSVT big, but I'm not asking anyone permission for that. So, so I think
so
that's
a lot less hassle for you as a therapist and less hassle ultimately for your patient as well.
Yeah. And then we offer one-on-one care always with our providers. So, they're not working with not anyone else except your, doctor of physical therapy or your OT or, whoever it might be. So that's also a benefit that way too.
They have your undivided attention and you're not trying to juggle multiple patients at once. Yes.
You got it.
Or see 36 patients a day like Eric said. You're right. Right. Yeah. That is nuts, but unfortunately we hear that, right? And we don't like to hear that. So, I know that a lot of therapists love this idea of cash-based practice, but their knee-jerk reaction is a little fear, like, oh, can I be successful? How am I going to get clients? Can I get clients? Now, obviously, you've been successful. You've opened a second clinic. You've got multiple providers. Patients are coming back. What's the secret sauce, Tammy, of making that really successful, finding patients that can pay cash and growing your business?
Yeah, I think just number one is probably just believe in the value that you provide. So, I think that's part of it, is knowing that our services, oh my gosh, like how great are our services, especially for the people with Parkinson's, that we have direct results within a month's time. Like there's no drugs that can do that. There's nothing that can kind of match that. So I think know your value and know that there's such a need. I read a statistic a couple of years ago that said only 4% of our population actually uses physical therapy and occupational therapy services. So, so we don't need to compete with each other. We actually just need to educate everyone around us that at some point in our lives, and probably multiple times, we should be really like a dentist. You need to come in and get your eval with your therapist and, make sure you're aging as gracefully as you can and optimizing your health as great as you can. So that's number one. Number two, I would say, don't treat it like a hobby and expect it to make you lots of money. So, if you're going to do it, and I think Lindsay will speak to that too, you just kind of got to jump in and commit to it. And then if you commit to it and it's successful, then awesome. If not, then that's okay. We have lots of jobs out there for us as therapists as well. But know your value, commit to the goal in mind that you might have. And then number three, I think just always come back to why you're doing it. So provide that excellent scenario for your patients and your clients, and then the word of mouth will spread and you'll be good to go.
That's great. That's great. I love that. A question that we get a lot as faculty is, for this type of practice model, do you, in LSVT big, it's 16 visits plus an eval, maybe another discharge assessment or something. Do you charge per visit? Do you charge like a package rate? How have you find that works the best for your clients?
Yeah, we have options for all of it. So they can pay per visit, but most often than not, we do have packages. And then we have a specific one for people with Parkinson's that come in for our LSVT big program, that then it reduces the rate a little bit that they would have, excuse me. It's all right. So it reduces the rate a little bit. Everyone wants to know that they're getting a deal. We don't reduce our rates a lot because we want to know that there's value that we're providing that way. But the package, I think, is the best way to go. The other thing is to really tack on your initial eval to that package rate and your you know, if you need another visit for your discharge, that would be, so you just kind of all encompass, here's what you're getting, here's what you're getting into. Everyone's going to a medical provider for a solution. So as long as you're covering what solution you're going to provide and what the outcome's going to be, we really don't get hesitancy with that. So yeah.
Tammy, that's really interesting. And I hope that all of you have also enjoyed hearing from Tammy. I know we could chat for a couple of hours, but we're going to move on and to Lindsay and talk about mobile practice a little bit. So Lindsay, I'm just going to spotlight you here. Welcome to our webinar, and let's dig in a little bit. And first question first, tell everyone exactly what that means by mobile practice.
Right. Yeah. Thank you for the question. It's not like a bookmobile. A mobile practice is a outpatient practice that can treat a patient wherever they are in the community. Most often for me, that's in their home, but it could be the workplace, the gym, the grocery store, the places that are meaningful to a patient.
All right. So what's then the difference between mobile practice and home health if both of those providers see the patient in their home?
Mm-hmm. That's a really good question, and that's something that comes up a lot. I get that from fellow therapists, and I even get that from doctors. So one of the easiest ways for me to explain it is if we're talking about Medicare, because I am actually a participating provider for Medicare, is that home health is under Medicare Part A, where outpatient or mobile outpatient is under Medicare Part B. And to kind of break that down a little bit more, home health has a lot of regulations for getting that care. Typically, it's a recent hospitalization. Up until the pandemic, a nurse or a physical therapist, and Sherry, maybe you can help me understand this. Maybe a speech therapist could open the case, and there needed to be at least 2 providers on a case. And a patient has to be quote unquote homebound to receive this therapy. Mobile therapy, it's outpatient care. It's usually a step after home health care, but not always. And it's just taking place in someone's home because that's where they prefer to have the care. And that might be because it's easier for them. It's a transportation issue. Maybe there's a lot of family dynamics going on, which I've found, or maybe it's proximity to care. So I just cut out all of those challenges that typically get in the way for people to have the traditional outpatient care that they need by coming directly to them.
It's so fabulous. And so the billing is exactly like you'd bill for outpatient therapy, whether it's, Medicare or private insurer. So really great. And, you used to work as an outpatient therapist in the cold Midwest. Tell us a little bit about that experience and how this has improved your life as a clinician and your patients because of that.
I mean, there's one individual, for example, that I worked with, and in the middle of the winter, and he was like 6'3", and his little wife was maybe 5 foot, and she was the driver, and he also had orthostatic hypotension. He could just faint at a moment's notice. So already she had a huge challenge getting him in for his therapy. And we were doing the LSVT big protocol, which is 4 days a week for 4 weeks in a row. And we got a huge winter storm. Now they couldn't even leave their house or their driveway, let alone get to therapy a reliable time every single day. And that just cut out everything for him. And he lost progress. And that just got me thinking, there has to be a better way. Now we have multiple options: telehealth, could have been an option, but that wasn't something that was even on the table at the time.
Mhm.
So I figured once I learned about mobile therapy, that could just increase that ease, increase that access for people like him. And that's very common with the type of people that I work with now, even
Mhm.
though it's not as cold here, but we
Yeah.
did have some
Oh yeah.
winter weather this year.
Yes, and it can get icy, and that's dangerous in the hills of Cincinnati, I know.
Mhm,
Yes, definitely
mhm.
challenging. So now that you've, been seeing patients in your homes, what other benefits have you seen in terms of being able to provide them personalized care with LSVT Big?
I've seen a lot of benefits. One, people that I have worked with tend to take on a lot more ownership over their care. And I'll see them go out and buy those wrist weights because they said, oh, well, Lindsay said this is going to increase the challenge. We also get to do our therapy in the exact same spot where they're going to do their
Mhm.
homework, which is an essential part of the LSVT program, is doing daily homework and weekend homework. If I know that their goal is to walk to the mailbox, well, we're going to work on walking to their mailbox on
Mhm.
their driveway, which may be a hill or maybe gravel. So the saliency is
Yeah.
the best, actually. I also see that it is less burden on the family.
Mhm.
It's easier for the family to be involved. And I also have found that I'm able to include a lot more of the home safety piece. So maybe I go in for initial LSVT eval, but I find out they're remodeling their entire bathroom and now need a consult on what they
Mm.
should do because they have this new diagnosis of Parkinson's disease. So I'm finding I'm just able to treat the whole person and the whole family much better than just, let's just do this therapy and then send you on your merry way.
I love that. And I know for all of the therapists that are watching us that work in outpatient or inpatient settings, they're probably kind of drooling with jealousy right now, thinking, oh, how wonderful that would be to not have to imagine what their environment is or simulate it, but really work in the environment. And I think same thing goes for speech therapy too, that, you know, working on communication activities in context, seeing what the dynamics are with the people that they're communicating with, the background noise, those kind of things would really, really be beneficial for a lot of our clients with PD or other neurological conditions. So if someone was like, man, that sounds great, I would love to do that. Like, what's your piece of advice for someone that wants to start a mobile practice or join a mobile practice?
Mm-hmm. Mm-hmm. I would say if you're interested in starting a mobile practice, understand your area and what the demand is for it. There typically will be demand. And you might be starting something that people in the area don't understand. So getting the elevator speech down pat and knowing who the potential referral locations and sources may be. Tammy was saying that they do a lot on social media, and that's awesome. And that works for her clientele. I haven't found that to be the best way to reach my clientele. So, kind of understanding that difference, and then also starting to network really strongly with anyone in the area. I've been amazed at the places that I have found patients or that they have found me. One was the local gym that provides rock steady boxing. When I moved here, I just started volunteering there. And now I've had so many wonderful opportunities come through them. And just I still talk to doctors, and I find it very important because I think otherwise they're just doing the traditional thing that they know, and it's referring to their outpatient clinic. And what I want patients to know is they have a choice. You, as a patient, you have a choice about who provides the care. You don't have to go just with who the doctor told you. And so you can have, I typically do like an over the phone consult with anyone. So we determine if it's going to be the best fit for us. And I have had some people that I wasn't the best fit for them. They wanted to use their private insurance and go to a clinic, and that's great for them. So if you're looking to start as a therapist, either on your own or joining a private mobile practice, know that there will be some times that it won't work out and times that there will. But as long as you're still serving people, you will find a lot of satisfaction.
Mm-hmm. I think that's great. And I can't wait to see how your practice grows, Lindsay, over time. I know it's going to be great. And I think that it's, like you said, it's getting the word out, because there's so many people that have never heard of that option. You know, even within the therapy world, there's people that I run into all the time that said, wow, I didn't know that was a thing. But it's wonderful for both the clinician and the client, or at least it can be.
Yeah.
So yes, thank
Appreciate
you. Thank you for joining us today. And for all of you that have questions for Lindsay, you have a few minutes left. Here is one before I let you off the hook. I'm a mobile Medicare Part B and private practice SLP, and it's so neat to see people in their homes for carryover, like answering the phone with a loud voice. Yes, thank you for that example. I think that's really great, and we'd love to see all three professions be readily accessible in this type of practice setting. Okay, well, let's shift gears a little bit and talk about telehealth. And I'm gonna spotlight Sherry here so you can all see her a little bit more. Thank you for joining us, Sherry. Now, you're a speech language pathologist and going to be speaking about LSVT Loud, but I know that a lot of what you're going to be talking about will also pertain to LSVT Big. If there's some nuances in there, happy to jump in. And if any of you have questions about the PT OT side of things. So you mentioned that providing telehealth is relatively new for you, thanks to the pandemic. Is that right?
That is true. I think that I did do the LSVT Global webinar on telehealth prior to the pandemic. Like I said, I had an inquiry from somebody who did not live near my clinic. And so it started as an opportunity to start in telehealth, and sure enough, the pandemic came along, and this individual was already scheduled. So I just dove right into it, with the support, of course, from LSD Global.
Yeah, that's great. I love that. I think that's a theme today, is like, if you want to do it, sometimes you just got to jump in with both feet and go gangbusters and just do it. How do you determine, or how would you determine if someone is appropriate for receiving LSVT Loud via telehealth?
Well, I think, I mean, the most important thing obviously is technical support. So depending on who the person is, where they are, how old they are, what their experience is with technology, you just want to always make sure that they have a computer. And some people connect with computer and some people connect with tablets. I do prefer when people connect with a computer. I just feel like it's easier, because people can get kind of jumbled up with the tablet. But so the technical support obviously is a big part of it. So are they familiar with technology? Do they know what Zoom is? Does their computer have a camera? And do they have some support? Like, is there somebody else in the home that can help them? Is there a family member that can come over? And I will always do a kind of a 15-minute test run before we start the LSVT program, to make sure to get people comfortable with this scenario, understanding how we're going to share screens. So I will do something in advance of starting LSVT to make sure that everybody's comfortable. I can see what their setup is, and maybe have their tech support person with them, perhaps. So yeah, I think that's important.
Yeah, I think so too. And that's similar advice that I've heard from LSVT Big clinicians and just even general physical and occupational therapists who are providing therapy via telehealth. Important to do that tech screen before you jump in with both feet and doing it. And with PT and OT, of course, there's the additional screening for safety and balance and all of that to make sure that they're appropriate to be seen in that type of remote setting, and do they have help and caregiver and emergency plans, and lots to learn for sure, to see who is safest, who is best for telehealth, but it can be effective. Have you ever done like a hybrid model where you do maybe the first visit in person or some of the visits in person and then launch into telehealth? I know in PT that's been done somewhat.
Right, and I do always meet the individual in person and to do the evaluation in person, because I do look at the vocal folds. Then I will say to somebody, I would like you to come into the clinic so we can do your full evaluation. And like I said, look at the vocal folds, I think is important. And I have found that through COVID and the whole telehealth thing that you get a little bit more established in your relationship when you have the opportunity to meet the person in person. For a few of my other clients who I have not been able to meet in person, I feel when you do finally meet them, something else clicks when you meet somebody in person. So I always try to start with an in-person evaluation, establish our relationship, talk about what LSVT is going to be, make sure that we can move forward successfully. Yeah.
Great. And I think it's obvious that there's benefits to the client in terms of accessibility, no need for transportation, that kind of thing, by doing therapy via telehealth. But are there any other benefits that you've seen to treating them, quote unquote, in their home?
Yeah, I mean, very much, I can just repeat what Lindsay said. I mean, they're in their home, they're comfortable, they're in a comfortable chair. They haven't had to, get up and get out of the house. They haven't had to enlist the support of somebody else getting them to the clinic. I think that it's just so important. And then same thing, people are around, you can engage family members a little bit better. You can have them use their own material at home, maybe a book they're reading or writing. I had a gentleman who was writing a book, and he was able to use that material for practice. So yeah, very, very similar to what Lindsay said, just the fact that they're in their own home, you can access things that are familiar to them and that they're comfortable and that they haven't involved a lot of time getting back and forth to the clinic. Yeah,
definitely. So here's a technical question that came in the chat. Is there a way to analyze voice over Zoom?
Yeah, so we could do, like maybe 3 days on voice evaluation over Zoom. And I'll try to give you the short answer is yes, you can evaluate voice over Zoom, and there's many different ways to do it. Equipment is a very, very important part of evaluating, for audio and perceptual evaluation. But what I have done, usually if I have to do evaluation through Zoom or take recordings so that I can monitor pitch and loudness, or at least have something to compare for outcomes, is I talk the person through downloading Pratt on their computer. And for anybody who might not know, Pratt is a free acoustic evaluation software. So I talk that individual through downloading Pratt and taking the recordings on their end and then sending them to me. So again, there is quite a lot involved in evaluating voice through telepractice, but that is what I found the best, rather than trying to record on my end through the computer. So there's some very easy ways to guide even the lowest tech person through taking recordings on their end. And then they send them to me, and I also evaluate them in Pratt. So it's the same software.
That's great. And if you have time later, maybe you could throw that into the chat.
Oh, sure. Yep.
Yeah, okay. Tips for telehealth with moderate or more significant cognitive impairment.
Yeah, I think it's important to have somebody else there with them. I think it's perfectly you're perfectly able to do therapy. It would be the same in your office.
Yeah.
You would want
Yeah.
somebody with them potentially. And again, that's the importance of meeting people up front to kind of to have that initial assessment of what you think you might need for therapy to do the program. But I think one of the things you have to remember is your ability to be a good clinician. So it doesn't really matter if it's telehealth or they're sitting right in front of you. You know, what are the tools that you're going to use, and what do you need to be successful with that patient? You're still going to think the same way as a clinician. It's just happens to be through the computer.
Right. I think the same could be said for PT and OT as well. If they've got significant cognitive involvement, you know, it's always best practice to see who the care partner is, involve them, train them, etc. And help with the technology piece, of course,
Right.
which is, you know, an add-on piece with providing telepractice. You know, we all hope that this pandemic comes to an end someday, and if it does, do you think that you'll continue to offer telehealth to clients when it would be appropriate or beneficial?
Absolutely. Absolutely. I think I hope, you know, others have also realized that we're pleasantly surprised, satisfied, successful with being able to provide therapy through telehealth. Again, I think it was Lindsay. There's so much. What I noticed right off the bat is the accountability of the patient. That because I'm not sitting right there with them, they actually take more accountability for success on their end, and establishing when and how they're going to do their homework. They're in their own home. They know where they're going to do it. They've been doing the exercises with you in their home, so they're familiar. It's not like, you know, you feel like you're okay in the therapy room because it's private and then you don't really want to do it at home. All that gets worked through. And I think the other biggest benefit is time, that people are not traveling. And through everything that I heard today, actually, through all the practice models, I think it really shows how we're doing so much better at patient-centered care. I mean, everything we've talked about today really benefits the patient. You know, having the therapy in their home or at their workplace, or being able to go right to the clinician and not waiting for a referral or you know, slogging through paperwork. Everything we're talking about, including telehealth, benefits the patient.
I think that's so true. There's so many more solutions and options for people with PD and other disorders than there used to be even just a few years ago, which is really, really positive. There was a question that came in via email last week to someone that couldn't attend today's webinar, but she'll listen. And she wanted to know what platform you use for telehealth, or if there's one that you recommend in particular.
Well, in my practice, I use, again, I'm in Canada, in British Columbia, but I think I use Jane, and I think Jane is an international platform. So I use Jane for my scheduling, for my whole administrative aspect of my practice. And Jane has a video platform that meets the, you know, the privacy standards and all that. So I use Jane. There's been a couple circumstances where we've had to switch to Zoom for some reason that Jane wasn't working that particular day. So it's nice to have an option to go to Zoom, but I use Jane, and then I've been quite happy with it.
Excellent.
With it all. Yep.
All right. One last question. There's so much that we can learn via, you know, about telehealth, as whether you're a PT, OT, speech therapist, and additionally more information specific to LSVT Loud, right? So what are some recommendations for our audience, for both those that are not yet certified and those that are certified, about how they can learn about telehealth for delivery as a speech language pathologist in particular?
Well, I think the first place you go, obviously, is LSVT Global, because the resources are there. And there's a webinar on providing telehealth. There's the companion, which I don't personally use, but that's another software program that I think it would be perfect for telehealth. But I think accessing your resources in LSVT Global is probably the best thing to do to start telehealth once you're certified in LSVT. I was thinking, I've got different notes here. Part of me thinks it would be important to have some experience one-on-one with people with LSVT before you go telehealth, but I'm not so sure that has to be true, because it's whatever your experience is wherever you start, and again, the bottom line is to be a good clinician. No matter what you're doing. So you've got good clinical skills and you can provide them in whatever scenario you need to.
Yes, I think that's spot on, and succinct, but really excellent answer. And if you're a PT or OT watching today, start with the national organizations. If you're a American, start with the APTA, AOTA. They have a ton of information on all the nuts and bolts about telehealth, and a lot of it's free information that came out as a result of in response to the pandemic. And then last year in 2020, we did a couple of webinars specifically on LSVT Big for LSVT Big certified clinicians that are wondering how to dip their toe in the water and start. So if you are certified and watching us, interested in that topic, please go to your LSVT clinician account and you can find those on-demand webinars that we did last year. All right, we are running short. We're getting close to the end of the hour. And so I want to, first of all, thank all of our panelists. Lindsay had to jump off, but thank you, Tammy and Sherry, for sharing your pearls of wisdom. My goodness, you both have so much experience and passion for helping people, and we're just so grateful for your time that you took today to give us the short and sweet answer of your practice and all of the successes that you've had. I just want to pop up my slide right here. Hopefully you can see it all. We do have a webinar coming next month that we would love for you to join. It's a public webinar, and the intended audience is for people with Parkinson's disease and for SLPs. So if you're a speech language pathologist in the audience, you're welcome to attend. Please also invite those that you know that have Parkinson's and their family and caregivers for this important topic about what we know about LSVT loud and swallowing impairments associated with Parkinson's disease. And that will be on Wednesday, August 25th from 2 to 3 p.m. Eastern. Again, it's a Wednesday, just like it is today. So same date, same time, 1 month later. And if you have any other questions, please do email us at info@lsvtglobal.com. Remember to complete the survey that will be coming to you a day or two later after this webinar. And this webinar will also be posted in an on-demand format to our blog, and that address is blog.lsvtglobal.com. You'll be able to find this webinar, its handout, and many other webinars that we've done in the past. So thank you again for joining us, and we'll see you all next month.